Pain in the buttocks, sacrum, and coccyx area can occur due to issues with the gluteus maximus muscle. In this video, you will learn the causes of the pain, exercises to relieve discomfort at home, and useful recommendations to prevent the recurrence of pain. I am Dr. Chernov. Enjoy watching. The gluteus maximus muscle forms the prominent part of the buttock and is quite a large muscle. It is twice as heavy as the combined weight of the gluteus medius and minimus muscles. At the top, the gluteus maximus muscle attaches to the posterior edge of the ilium, the sacrum, and the coccyx, and at the bottom to the iliotibial tract and the femur. When there are issues with the gluteus maximus muscle, a characteristic gait is observed with reduced load on the affected leg. Difficulties arise with prolonged sitting, especially on a hard surface, and there is a limitation in hip joint flexion. Areas of tension or trigger points in the gluteus maximus muscle are located in three regions. The first trigger point is located near the sacrum and reflects pain in the sacroiliac joint area, along the gluteal fold and into the upper part of the back of the thigh. Sometimes pain may occur in the lower back. The second trigger point is the most common and is located just above the ischial tuberosity. It causes pain across the entire surface of the buttock, as well as deep within it. The pain may spread to the lower parts of the sacrum, as well as laterally below the iliac crest. When sitting on a hard surface, mechanical compression of this trigger point can cause intense pain comparable to the sensation of a nail being driven into the bone. The third trigger point, located in the lower inner part of the gluteus maximus muscle, causes intense soreness in the coccyx area, especially when sitting on a hard surface. Pain originating from the trigger points of the gluteus maximus muscle intensifies during sudden muscle contraction, such as during uphill climbing or stair climbing, during running, or while swimming. Such cramp-like pain most often occurs in cold water. Trigger points in the gluteus maximus muscle are often activated by sudden stress, such as during a fall or loss of balance, especially when the muscle undergoes a rapid contraction in an attempt to prevent the fall. A bruise to the gluteal muscle from falling backward or the injection of medications into the muscle can also activate trigger points and trigger pain sensations. Sleeping on your side with the top leg sharply bent can lead to stretching of the gluteus maximus muscle and the onset of pain. Prolonged sitting, especially when a person is partially reclining backward with straightened knees, is also highly undesirable and can cause compression of trigger points and restricted blood flow in the muscle. A forward head position with thoracic kyphosis while standing, which increases flexion in the hip joints, also causes overloading of the gluteus maximus muscle. Another common cause of the development and activation of trigger points in the gluteus maximus muscle, leading to pain in the gluteal region and lower back, is carrying a smartphone or wallet in the back pocket of pants, especially when sitting, as the wallet presses on the muscle for an extended period. You can independently get rid of trigger points in the gluteus maximus muscle through intensive mechanical impact followed by stretching of the muscle. You can apply mechanical impact on the trigger points using a large massage roller. Sit on the floor, bend your legs at the knees, and place the massage roller under the area of the gluteal muscles. Perform slow movements with your pelvis forward and backward. Look for the most tense and painful areas of the muscle. Once you find such an area, pause on it for 30 to 60 seconds, and then continue moving your pelvis forward and backward. You can intensify the mechanical impact on the right and left gluteus maximus muscle by shifting your center of gravity to the side. Support yourself on your feet in one hand, and roll the muscle for a few minutes. Then repeat the exercise on the other side. You can further intensify the mechanical impact by placing one leg over the thigh of the other leg. After that, take a small massage ball and place it under the right gluteus maximus muscle. Move your pelvis forward and backward, right and left, clockwise and counterclockwise. Pause on painful areas of the muscle for 30 to 60 seconds, and then continue with slow massage movements. Then place the massage ball under the left gluteus muscle and repeat the exercise. A more complex, yet even more effective version of this exercise is when one leg is on the thigh of the other leg. In this case, intense mechanical impact can also be applied to the deeper located piriformis muscle. Be sure to repeat the exercise on the other side. If the previous exercise was difficult for you, try the simplest version of working with the massage ball while lying on your back. Bend both legs at the knee joints, lift the pelvis, place the ball under the area of the right gluteus maximus muscle, and straighten the right leg. Apply massage pressure to the muscle for a few minutes, and then repeat the exercise on the other side. After performing any of the myofascial release techniques described above, proceed to stretch the Gluteus Maximus muscle. The Gluteus Maximus muscle, when the torso is fixed, extends the leg at the hip joint, and when the legs are fixed, it rotates the pelvis backward, participating in the flexion of the spine, as well as performing a number of other functions. Therefore, to stretch it, you need to perform exercises that involve flexing the hip at the hip joint with a fixed pelvis, or anterior pelvic tilt with a fixed thigh. The simplest exercise for stretching the Gluteus Maximus muscle is the lying position. Bend one leg at the hip and knee joints and grasp the thigh with your hands. Bring the leg closer to the body and hold the final position for 1 to 3 minutes, maintaining deep breathing and gradually increasing the stretch of the muscle. This exercise can be combined with the post-isometric relaxation technique. To do this, inhale and tense the Gluteus Maximus and the muscles at the back of the thigh, resisting with your hands. Then with a slow exhale through the mouth, completely relax the leg muscles and move the thigh towards the body. Repeat this sequence of actions several times and be sure to perform the exercise on the other leg. Another simple exercise for stretching the Gluteus Maximus is as follows. Take a chair and place the foot of one leg on the seat of the chair. Grab the backrest with your hands and tilt your pelvis and torso forward. Hold the final position for 1 to 3 minutes, maintaining calm and deep breathing, and then perform the exercise on the other side. You can also stretch both Gluteus Maximus muscles simultaneously while sitting on a chair. Place your feet wide apart and lean forward. Lower your hands between your legs and relax your neck. To achieve a more intense stretch of the Gluteus Maximus muscles, sit on the floor with your legs straight. Grab your shins or feet with your hands and lean your torso forward as you exhale. Hold the final position for 1 to 3 minutes, maintaining deep breathing and feeling the stretch in the muscles. This same exercise can be performed while standing. Bend your torso towards your straight legs and try to completely relax your neck. Use your hands to help bring your torso closer to your legs. There are also a number of more advanced exercises that stretch the Gluteus Maximus muscle even more intensely, but they require prior preparation and careful practice. After completing all the stretching exercises, it is necessary to perform several smooth, active movements that engage the Gluteus Maximus muscle. For example, you can stand by the wall and bend and straighten your leg at the hip joint several times. If you have the aforementioned issues with the Gluteus Maximus muscle, limit the duration of sitting. For example, if you need to work at the computer for a long time, set a timer for 15 to 20 minutes and place your smartphone at the other end of the room. This will help you combat prolonged static load on the muscle and encourage periodic stretching. While sitting, it is necessary to maintain proper posture, avoiding a forward head position and rounded shoulders. It is important to use a soft orthopedic cushion, especially if your chair has a hard surface. If you are accustomed to sleeping on your back, place a roller or a small pillow under your knees to prevent prolonged shortening of the Gluteus Maximus muscle. If you sleep on your side, place a pillow between your legs. When getting up from a chair or climbing stairs, place one hand on your hip to reduce the strain on the muscle. It is important to note that the Gluteus Maximus muscle significantly contributes to maintaining an upright posture and is actively engaged during walking. But if you have improper foot placement with predominant external rotation of the foot, then during the extension of the leg at the hip joint, the Gluteus Medius and Minimus muscles are engaged instead of the Gluteus Maximus. This can lead to insufficient training of the Gluteus Maximus and overloading of the Gluteus Medius and Minimus, resulting in a specific pain pattern. We will talk about these muscles in the next video. Be sure to subscribe to the channel so you don't miss the release. I also recommend watching the video about the piriformis muscle, which lies beneath the Gluteus Maximus and causes pain in the buttocks, sacrum, along the back of the thigh, and can impinge on the sciatic nerve. And in the playlist linked in the description, you will find reviews of other muscles. Stay healthy and see you in the next videos.